Welcome to Pulse&Pressors, where critical care gets crystal clear. Atracurium is a benzylisoquinolineium neuromuscular blocker that shares many properties with cisatracurium, but differs in its histamine release profile and higher production of the metabolite laudanosine. It is metabolized independently of organ function, making it useful in renal or hepatic failure. It does not produce fasciculations since it is a non-depolarizer. A defining pharmacologic feature is that atracurium is composed of 10 stereoisomers, contributing to variability in potency and side effect profile compared to the single isomer cisatracurium. Atracurium blocks neuromuscular transmission by competing with acetylcholine at nicotinic receptors. This prevents depolarization and causes flaccid paralysis. The absence of depolarization physiology avoids potassium shifts or muscle fasciculations. Its metabolism relies primarily on Hoffman elimination, the dominant pathway, which is a pH and temperature-dependent process, and secondarily on ester hydrolysis. Alkalemia and hyperthermia accelerate breakdown, while acidosis and hypothermia slow it. This gives it organ-independent clearance, even in multi-organ failure. Atracurium has an onset of 2 to 3 minutes and a duration of 30 to 45 minutes. Its potency is measured by its ED95 of approximately 0.2 milligrams per kilogram. Atracurium is a mixture of 10 stereoisomers, giving it more varied pharmacokinetics and a less clean side effect profile than cisatracurium. It produces laudanosine, which has CNS stimulating properties. Rapid boluses can release histamine, making administration technique important. Histamine release is the major limitation of atracurium. Rapid boluses can lead to flushing, tachycardia, and hypotension. For this reason, the drug is often avoided in unstable ICU patients. Cisatracurium was developed specifically to avoid this histamine response. Laudanosine is a metabolite that can accumulate during prolonged infusions. High levels can theoretically induce seizures, especially in severe organ failure. Cisatracurium produces significantly less laudanosine, making it safer for long-term paralysis. Dosing includes an intubation dose of 0.4 to 0.5 milligrams per kilogram, maintenance boluses of 0.1 milligrams per kilogram, and infusion rates between 5 and 12 micrograms per kilogram per minute. Because clearance depends on pH and temperature, dosing must be adjusted during hypothermia, alkalosis, or acidosis. Atracurium is effective in patients with hepatic or renal dysfunction and is commonly used in OR anesthesia for moderate-length procedures. It offers predictable paralysis when physiology is relatively stable. Atracurium should be avoided in severe hemodynamic instability due to its histamine release potential. It is also inferior to cisatracurium for long-term paralysis because of laudanosine accumulation. Asthmatic patients may experience bronchospasm with histamine release. Aminoglycosides, magnesium, and beta blockers potentiate paralysis, while chronic anticonvulsant use increases resistance. Acid base and temperature shifts significantly alter metabolism, important considerations in the OR and ICU. Reversal is achieved with neostigmine and glycopyrrolate. Sugamidex is ineffective due to atracurium's chemical structure. Because it undergoes spontaneous breakdown, many clinicians rely on natural recovery, guided by train-of-4 monitoring. Although atracurium functions independently of liver and kidney function, its histamine release and laudanosine accumulation make it less desirable in unstable critical illness. Cisatracurium is overwhelmingly preferred in ARDS and ECMO cases. Atracurium remains useful in operating room cases requiring predictable paralysis where hemodynamics are stable. It is also a viable option in renal or hepatic failure when cisatracurium is unavailable. Atracurium provides organ-independent clearance, but carries more side effects than cisatracurium. While reliable, it is less elegant pharmacologically. Cisatracurium remains superior for high-acuity ICU care, but atracurium retains utility in controlled OR environments. This is Pulse&Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.